After looking at some of the risk factors and how the coronavirus develops in the person, there are some simple diet, lifestyle, and herb suggestions that might be helpful with coronavirus. Hi, my name is John Immel, and I'm the director of the Joyful Belly School of Ayurveda. And this is what I look like. Let's talk a little bit about the development and course of coronavirus, and then the risk factors, and then we'll talk about some strategies. All right, so the disease presents itself with fever and malaise at first, including headache, muscle aches, etc. Then a cough or a sore throat, and then difficulty breathing and an increased breath rate. And this can progress to mild pneumonia, then severe pneumonia, then acute respiratory distress, finally sepsis, septic shock, and perhaps even death due to sepsis or respiratory failure. What about some of the risk factors in dying? This is as reported by the hospital in Wuhan, China. I've looked at several articles analyzing etiology and epidemiology regarding the disease, and you can see those articles on Lancenet and New Scientist, which have put together some nice statistics on some of the risk factors of dying from the disorder. And some of those include age, and everyone's heard of this, right? It's the elderly that are dying from this disorder, and the children aren't getting it. But also some other ones are diabetes and heart disease increases greatly your risk of dying. Hypertension was actually one of the most common comorbidity factors for coronavirus, and of dying due to coronavirus. And also males were much more likely to get the disease. Now, does that mean there could be a lot of social factors involved there in regards to exposure and things like that between the different genders? So I don't know if males are weaker or if they're just getting exposed more often. Anyway, so right away I'm going to take a look at some of the factors in the development of the disease and the risk factors of dying, and try to put it all together to come up with a good strategy for diet, lifestyle, and herbs, right? Some good direction, clues, or things to look into. So the question I'm going to ask myself is, what's common to the elderly, people with heart disease, people who have pneumonia and diabetes, but is not found in children? Well, my first thought was weak immunity, but then I'm thinking, yeah, it's true. Children and the elderly have weak immunity, and people with diabetes have weak immunity too. But children aren't getting these severe symptoms. So what conditions or problems do you find in the elderly, but you don't find in children? That's the thing that comes to mind there is good circulation and metabolism. Children have great circulation and great metabolism, but the elderly don't. And people who have heart disease, pneumonia, and diabetes typically have poor circulation as well. So I'm right away thinking poor circulation and poor metabolism are factors in this disorder. And this is true in general for the lungs. So I'm not surprised to find this, right? We're looking at immunity, circulation, and metabolism, typical things to look at when you're dealing with lung disorders. And it seems to be true here too. And what do the elderly, if you have poor circulation and poor metabolism, what do you need? You need invigoration. You need to open up the blood vessels. You need to stimulate the heart. Need to keep warm. And okay, so right there we're going to look at some herbs to help with that. What about infection and diabetes? There's some similarities between those two, and those two are both affected by poor immunity. So we don't want to ignore immunity, even though we've seen that children have weak immunity but aren't getting severe symptoms. It's actually in later stages of development the immune system becomes a little bit more critical. In sepsis, which is how people are dying from coronavirus, we want to look at inflammation and what's going on, what we can do to reduce inflammation and increase chance of survival. And then we just want to look at the lung and respiratory tract in general. Let's get into it and talk about these ideas for a treatment strategy. And first thing I want to mention regarding treatment strategy is talk to your doctor before making any change to your health and wellness routine. And definitely seek medical treatment if you suspect you have coronavirus. What I am outlining here is a strategy and the kind of approach that Ayurveda would take to figure out the best herbs, diet, and lifestyle for a disease. Obviously, these have not been tested yet. Coronavirus is a new disorder, and so this is not tested by the or has FDA approval or anything like that. This is just the illustrating Ayurveda's approach and some simple tips that we would think or guess might be helpful in this scenario. So we're going to take these ideas with a grain of salt, research them, check them out, see how you feel with them, that kind of thing, right? Not a substitute for medical treatment, okay? Well, what about the lungs? The lungs love heat, right? The lungs love heat and dryness, but they abhor dampness and coldness. That's an adage from Chinese medicine. And so whenever we're dealing with a lung condition, we're typically going to move in that direction. Not for every condition, but think about the damp winter day. Your lungs feel weak on those days, and hot and dry weather is known to improve lung function and support. Well, why is this the case? Your lungs are actually submerged in your body, right? And they're this hollow space. It's very unusual for the body to have this hollow, dry space in it. So the lungs naturally want to fill up with fluids, or the lungs have to fight to keep themselves from filling up with fluids. It's unusual to have a dry space internally. So the lungs, in a way, you could say that the lungs need a bilge pump, right? Just like a boat. If you've ever seen big ships, they have these pumps in the hull of the ship to keep pumping out water that manages to seep into the hull. Well, our body has these hollow organs. We need to keep pumping the fluids out of them. And what's the bilge pump in our body? The heart. A good, strong heart is going to keep the lungs dry, but heart weakness encourages fluid buildup in the lungs. And this is exactly why the elderly are very vulnerable in the lung area, that and low immunity. So you see a lot of the elderly developing pneumonia, which is part of the pathogenesis or development in coronavirus. And so we're not just looking at the lungs here, right? We want to see the other systems in the body that are affecting the lungs. Naturally, we turn to the heart. There's a reason why the heart and the lungs are right next to each other and so close to each other. And that's because great circulation is needed for lung health. And so the lungs work well and stay dry when the heart is strong. So we're going to think about warming up when I think about warming up the lungs, going right to starting with the lungs, and then we'll move over to the heart. I'm thinking of bronchodilators and herbs like Tulsi, common herb these days, awesome herb, also known as holy basil, and Ocimum sanctum, the botanical name. Cardamom is a great aromatic that opens up the bronchial tubes. Osha root, classic Native American and Western herbalism herb for the lungs. Echinacea, also really warm in the lung area. These are all lung warming herbs, and Tulsi has a number of other great properties that I think are going to end up helping us out here. Tulsi is a great vasodilator, etc. We'll talk about that in the circulatory area. I want to talk next about my favorite food for the lungs, which is daikon. Daikon root. If you can get some daikon root, wow, it'll warm up your lungs. You'll even feel the heat in your chest area. In general, spices are very supportive for the lungs because they warm up the lungs. I'm going to talk a little bit more about that in the circulatory section. All right, so let's move towards the heart, right? So cardiac stimulants right away are going to boost up that circulation. Black pepper, ginger, cinnamon, anything spicy at all. Your heart wants to circulate that heat that's created by the spices and get rid of it. Trikatu is a famous Ayurvedic formula that contains ginger and black pepper in it, and also a great lung tonic called Pipali. So think about Trikatu as a great cardiac stimulant and lung tonic for the heart. Vasodilators, Tulsi tea. Here's that word again, right? We're seeing Tulsi tea is not just a bronchodilator, but a vasodilator. Turmeric also comes up here. We hear so many great things about turmeric. Turmeric is known for invigorating the blood, right? I just love summarizing herbs. You can come up with 50, 60 things that an herb does, and it's mind-boggling, and no one could possibly remember it all. So I just love these simple phrases that describe the actions of an herb. Turmeric is known for invigorating the blood, and that's what the elderly need, is a bit of invigoration. So vasodilator, anti-inflammatory. It's great herb for the blood. Blood thinners can help with circulation, and so turmeric and boswellia both can help with circulation. Boswellia is also known as frankincense. Now, both of these herbs are great anti-inflammatories. What else? What is another great way of keeping the lungs hot and dry? Put on a sweater, right? Heat increases your heart rate and gets your blood flowing, and that's why your face looks red on a hot day in the summer. So put on a sweater, keep yourself warm. I was wearing a sweater while I was working on this presentation. I took it off because I think this shirt looks nicer for the video. And so I'm going to put it right back on as soon as I'm done with the talk. All right. Now let's talk a little bit about diabetes as a risk factor. When you see diabetes as a risk factor, already I'm thinking, well, maybe sweet blood is a risk factor, right? What about people who have sweet blood, but it's not exactly diabetes yet? So bacteria love sugary blood, right? If your blood is really sugary, sugary blood is thick blood, and thick blood is hard to circulate. Sweet blood means bacteria are going to love feeding off of your fluids. The saliva in your mouth. You ever notice after eating a candy bar that that your tongue tastes terrible after 5 minutes? Why? Because bacteria are exploding due to the spike in blood sugar level in your body. So keep your blood sugar levels low. That may lower your chances of bacterial complications. Now, I looked at treatment outcomes at the Wuhan hospital in China, and so it turns out that people who were given antimicrobials had better outcomes and much lower mortality rates. And so bacterial complications are part of the end stage, mortality rates, high mortality rates here. So we want to lower our chances of bacterial complications by keeping blood sugar levels low. And that's why in my house, as soon as this sort of outbreak started happening, we made a number of small changes to our diet and lifestyle. No more pizza. Sometimes on Friday night, kids' night in my house, we'll treat the kids to a little pizza. Or sometimes after dinner, we will have a little bowl of ice cream in the family. If everyone's healthy and things like that, we like to celebrate, enjoy life, all those things, right? Well, we're going to shift out of that pattern if we're thinking that there's lots of respiratory disorders going around, whether it's flu, coronavirus, or whatever. We're going to keep our blood sugar levels just a little low, make sure our blood's not too attractive to bacteria and funguses and other things that could attack us, right? So we're going to increase spices and bitters to keep blood sugar levels low, and we're going to decrease empty carbs and sugary foods like candy, refined flour, too much dairy. All of those things we're going to back off on. And it really depends on the person too. So just be thinking about that. Cinnamon is shown to reduce blood sugar. Bitters reduce blood sugar too. And I'm giving here kale and celery as some simple bitters. Celery is also great because it's a vasodilator and it's a diuretic, right? So let's talk about pneumonia and diuretics for a second, because pneumonia means your lungs are filling up with fluid. And if our lungs are vulnerable to filling up with fluid, we don't want extra water retention. Now, drinking water is not a problem. You should be drinking lots of water, right? That's a great thing. Drinking water doesn't cause water retention, but salt does. Salt and high sodium foods. Well, what about what's the opposite of sodium foods? Potassium foods, right? Potassium is a diuretic, sodium is the water retentive. And so parsley, celery, asparagus are some great diuretics that can reduce excess water weight. You know, if you're the type of person that tends to get puffy skin or you retain water in other areas, you can reduce your water retention by reducing inflammation and by these simple food diuretics, parsley, celery, asparagus. My wife and I she made it actually, I just ate it. A nice parsley cucumber salad the other day, which she chopped up the cucumbers, chopped up the parsley, and just mixed it together. It was great. It was such a tasty little dish. Maybe, she might have put a little oil in there with it. Maybe even she put a pinch of salt in it just to balance it out a little bit. And it was just delicious. It was like almost like a pesto or a tabbouleh kind of thing, and I ate it up. Just ate it up. It was great. That kind of greens, vibrant greens, are so great in early spring for increasing just your energy. In Ayurveda, it's called your prana. And it just feels good and refreshing this time of year. I always want to refresh my body this time of year. Always want to cleanse a little bit this time of year. And so hawthorn berry, by the way, is an herbal diuretic and cardiac tonic. You see here, we want herbs that have multiple properties that are going to help us. Turmeric, tulsi, hawthorn berry are some of them that I've mentioned so far. Pleurisy root is a famous herb in Western herbalism that reduces water buildup in the lungs. All right. What about dealing with the infection, hypertension, sepsis kind of factor? I mentioned before that hypertension was a really common factor in coronavirus. Doesn't mean causative. As I mentioned, this comorbidity can simply be other things that are common in the elderly. But we're just going to take a look at it, and this is going to be part of our guest. And hopefully, at some point, we'll have the data and research data to know what's causative and what's just a correlation. So the hospital reports, I mentioned this already, that there was the highest survival rate of patients when treated with antibiotics, antivirals, and corticosteroids. Well, what do the corticosteroids do? Is they calm down the immune system and inflammatory response. And the antibiotics and antivirals attack the virus itself, and also other opportunistic bacterial infections that are taking advantage of the weakness of the system caused by the virus. And that's where things get tricky, right? It's not like you just have the virus. Well, the virus creates a weakness, and then bacteria infect it. Now you're dealing with a bacterial and a viral infection, etc. So in sepsis, your immune system goes haywire and overreacts, and what's called a cytokine storm. And that is a significant factor in death due to coronavirus. So we want to bring balance to the overactive immune system, but we also want to strengthen it. So it's kind of like this: if you overstrengthen it, it's going to be, your immune system will be hyperactive. That's called an allergy, right? When your immune system's hyperactive. So we want to have a balanced immune system, but we want to have a strong immune system. All right, well, what's the major factor that causes your immune system to go haywire other than the disease itself? Is toxins in your body. Toxins in general make your immune system haywire and scramble your immune system. It it weakens and scrambles the immune system. So in general, when there's diseases floating around, I keep my system pretty clean, as a preventative measure. And toxins, by the way, don't mean, toxins from the nearby factory. It means toxic buildup from bad food choices, and also your body's reaction to bad food choices creates a lot of toxic buildup in your body. Your own body creates a lot of the toxins in it as a response to eating poor foods, right? So, as I mentioned, we did a little lifestyle switch in my house. We're not doing late night movies right now. We're not doing pizzas, bowls of ice cream, etc. Foods with hydrogenated oils, we never do that anyway, but I just want to mention that is something that is going to increase inflammation and toxins in the body. And I'm also eating foods that are going to keep my digestion really strong. Now, I don't want to, get a little, embarrassing here or something, but if you're farting, it means that food is rotting in your gut, right? Gas is from bacteria creating air in your intestines as they eat the food in your gut. That's where it comes from. And so what you want to do is make sure that you're digesting your food well and you're not getting any gas. That means that food isn't rotting in your gut. This rotting food in your gut creates a big burden on your immune system and greatly increases inflammation. So keep your digestion strong with easy to digest foods. There's a whole list on Joyful Belly, joyfulbelly.com, my website, that talks about, that lists all the foods that are pretty easy to digest. Get a good night's sleep. I would also list the foods that are hard to digest on the website too. So just look for that and keep your digestion strong. Get a good night's sleep. Don't reduce toxins as much as possible, and that's going to help reduce inflammation. It's going to help reduce, your immune system going haywire. So, cilantro, by the way, is a great anti-inflammatory, diuretic, and calms the immune system. So take a look at that one. Turmeric, boswellia, I mentioned before. Check out this Native American herb that kept the Native Americans healthy during the 1918 Spanish flu epidemic. And that's Lomatium dissectum. That's an herb I never heard of before. I want to take a look at that. But also your colorful fruits and vegetables are really high in antioxidants, and that reduces free radicals produced by inflammation. So what's an example of a great colorful fruit this time of year? I think of beets. This is the time of year to eat beets in the spring. When you need to cleanse, because beets are a great laxative, they're a great liver tonic, and they're are bright and beautiful, and that means they're high in antioxidants. So that's going to reduce free radicals produced by inflammation. What about your antimicrobial and antiviral herbs? I put a whole list here: coconut oil, raw garlic, and oregano, ginger, kimchi, and other fermented foods. And your medicinal mushrooms also are also immune boosters too. So great. Your immune system is in your blood. So you want your blood flowing so your immune system can do its job. I also want to mention vitamin C and vitamin D and zinc. Vitamin C decreases organ failure in sepsis. Vitamin D balances the immune system so it doesn't go crazy. And zinc, misspelled zing here on the slide, says zinc strengthens the immune system. And then elderberry, traditional herb, elderberry flower and syrup for improving the immune system. All right, just a little bit on preventative care of the lungs. Simple stuff, guys. One, it's a respiratory virus. It enters through the nose and mouth. It spreads by coughing. So all the millions of articles on the internet are saying avoid exposure, don't spread it, right? And I'm not going to just repeat all of that because you can find it everywhere else. But also I want to just say a specific thing here. Even if you're young and healthy and think that you can survive this disease, still avoid exposure. You don't want to get the disease, feel fine, but end up spreading it to older people and be responsible for their death, right? You don't bear that don't bear that guilt, right? Just avoid exposure. Don't get it yourself, even if you're young and healthy. So avoid exposure, and if you think you might have it, don't spread it. But I'm gonna, there's lots of tips on the internet for that. But something I'm not seeing all over the internet that's really important is to remember grandma's advice, right? Just don't throw out grandma's simple old-fashioned advice. Keep yourself warm. Take care of yourself. Don't get run down. Relax. Don't give in to fear. Fear and stress hurts your immune system. So relax, folks. Get a good night's sleep. Enjoy the day. And take some simple precautions. Here's another really important one. Neti pot. Irrigating your nose and mouth daily. So apparently the coronavirus incubates for several days in the nasal passages. So studies, we don't have definitive proof that this works in coronavirus, just like all this other stuff I'm saying. Research it, talk to your doctor, before making changes, etc. But studies show that daily nasal irrigation significantly results in significantly fewer episodes of upper respiratory symptoms and faster healing times. Xlear is a saline nasal spray with grapefruit seed extract that has some antimicrobial properties. You can actually take your neti pot, normal neti pot formula, which is water and a little bit of saline, and you can make a tea with it using some antimicrobial herbs and rinse your nasal passages out with antimicrobial herbs. And you can just make that at home. And that would be a great thing to do. Drinking water frequently just washes the virus out of your mouth so it doesn't go into your lungs. That can just reduce your exposure until your immune system is up and running. So I want to thank all of you for your attentiveness to your health and to your body, and to just showing enough interest to help yourself and your communities stay healthy. A lot of these tips are useful for respiratory conditions in general, as well as potentially helpful for the coronavirus. This talk has been sponsored by the Joyful Belly School of Ayurveda. My name is John Immel. I'm going to put some links below that you might find helpful for diet and lifestyle for this. So stay healthy, everybody, and I look forward to the next time we get to talk together.